Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We're
therapist.
one of the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about how to sleep with an anterior pelvic tilt, the best sleeping position to sleep when you have this problem.
Right, make yourself comfortable, get a good night's sleep.
And we're going to go over the reasons why an anterior pelvic tilt is going to actually maybe increase your pain, especially if you have certain disorders.
Right.
Like arthritis and spinal stenosis and DDD.
Right.
Degenerative disc disease.
There you go.
I just had a
It's
patient with that
all
yesterday.
coming in just a couple minutes.
All right, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free. We upload every day. And if you haven't already, go over to Facebook and like us, because Brad and I, as children, we were not liked. It's a sad story, but we're trying to turn things around. So go to Bob and Brad.
There you go.
All right, Brad, take it away.
Okay. Anterior pelvic tilt. We need to clear this up. And we've got a nice demonstration right here. We're going to use Bob. Bob will help show this.
And we're not, I was going to show you can show the pelvis too, tilting on head.
I've got that,
Oh,
Bob.
sorry, go
Don't
ahead.
interrupt me, Bob. I'm on a roll. Can you face that way,
Sure.
Bob? There you go. Can you pull your shirt up a little bit? There you go. So we actually put this nice blue belt so you can see. Now this shows his anterior pelvic position, or the pelvic position. He's in a pretty much a neutral position now. Bob, can you go
Because I'm level.
Yeah, level this way. Now, can you go into, actually, we're going to use a stick to show we're level. Now go into that anterior pelvic tilt. Oh, did you see his, go back to there, and anterior pelvic tilt. There you go. Now, Bob does this very well. A lot of people aren't able to do this, but some people are actually stuck going to the anterior pelvic tilt. They're somewhat stuck in this position. I'm saying somewhat stuck because I think a lot of times they can change it if they work properly with it, but that's what we're looking at. Now show a posterior pelvic tilt, and then that, instead of going this way, we have a posterior, the angle goes the opposite direction. So that's the anterior pelvic tilt, and that can cause problems. It can be from tight hip flexors, okay? It can be from, Bob, fill me in here.
Well, I'm worried I wasn't supposed to talk.
You were daydreaming, weren't you?
No, but the
do
big
want to show
problem,
it on here.
Yeah, I want to show it on here because what happens when you do an anterior pelvic tilt, you're actually jamming all these little joints together on the back.
They call them facet joints, and if you have arthritis in your back, that's where it's really going to be a contributor to low back pain.
And if you have spondylolisthesis, and if you have spinal stenosis, I'm just throwing some diagnoses out there, actually probably even degenerative disc disease.
Sure.
All those things are going to feel worse if your back is in that arched position for a long period of time.
Right.
Now you can do it briefly, I mean when you're lifting or something like that, put your back in an arch, but you don't want to be in that way all night long. You're jamming those joints together all night long.
Precisely. Everything gets kind of, well, it gets all scrunched up and there's poor circulation, things are irritated. We just don't like that. So what we're going to do is give you some solutions so you can sleep well throughout the night, even with that anterior pelvic tilt until you get it straightened around.
Now, one of the things, Brad, we get asked quite often, do we recommend a mattress?
Right.
Well, I remember for years we were asked this, and Brad and I get approached by product companies every day, literally every day. And we never found a mattress we liked until now. This is the Sleep Ovation mattress. This can actually solve some of the problems we're talking about today.
Right.
Because of the way it's built. What it has is, it actually has individual, I know this sounds like a commercial, but this is the one mattress we do like.
Right.
It's got these individual baffles, like 700 of them. And the reason we like this is when I was younger, actually, I have a friend that wrote a textbook, and he found the best pressure relief came from this type of cushion. And this is a Rojo cushion.
It's very expensive, but it really offers excellent relief in the wheelchairs for people with problems.
Right, for pressure sores. And so if you look at this, it's built very similar to this mattress. It's got individual cells. And and this has got individual cells. So it really spreads out the pressure that you're going to feel. That's as much as I'm going to say about it. If you are interested in this mattress, we always get a deal for our people. So if you link, hit on the link below, you will get $300 off. And if you put in our code, you'll get another $50 off.
Yeah, it is a wonderful mattress, and that alone can solve your sleeping problems. If you don't want to get a new mattress or you can't afford it,
we're going to show you some less expensive options.
You can do right at home things you probably already have at home. And should we go
You want me to be the guy or what?
Yeah, you do that.
Because I'll take my shoes off and I'll get
take
comfortable.
your shoes off. See, because he's got the penny loafers and I have tie shoes. So
Plus, you'll be able to see this if you need to.
Right.
So what do you want me to start with? Probably the
back. Let's start supine, Bob. So
if I'm like this, you know, that's putting the pressure on that back. So I'm actually want to go flat like this.
Right.
A lot of people, I have a patient yesterday that couldn't sleep like this.
Sure.
He's been sleeping in the recliner. But if I took one of these leg wedges,
Sure.
it actually, he could lay there comfortably. Because look what's happening now. I'm actually, again, rotating that pelvis.
Sure.
And I'm opening up the joints. There's not pressure on them.
Yeah, those facet joints open up. It allows things to relax, more circulation, everything you need to be comfortable and sleep well.
Yeah, and these are really inexpensive and they feel really good. Brad and I really like these things. You sleep with these for a while sometimes, don't you?
It depends. Yep. As a matter of fact, last night I slept with my sleep wedge.
And you'll sleep for a couple hours. You'll sleep with it and then you take it out, right?
Right.
Okay.
Yeah. Now, you said, I know we said things you already have at home. People may not have that, but you probably have a few extra pillows.
Yeah, you would probably take quite a few pillows to get up into that range, but you can see how that, just that, by putting a bend in your knee can help, you know, rotate your pelvis back.
Right, so you can stack pillows of whatever you need. 2, you could use 3, depends on your pillow, how thick they are and whatnot. But that'll be a real nice way to get you more comfortable as well.
What if you tend to sleep on your stomach, Brad?
Well, you know, that's one thing. We've got a video on sleeping on the stomach. We really are not big fans of it, but we always get comments. People say they're a stomach sleeper and they're going to stay a stomach sleeper.
Sure.
They're comfortable, and that's fine. So why don't you lay on your stomach, Bob? And once again, with this, you just take a pillow.
Well, if I'm on my stomach and, you know, again, this could cause me to have the anterior pelvic tilt.
Right, it actually can worsen problems.
Yeah, if you have arthritis and such. So if you go ahead and take a pillow like this, you can help kind of turn it the other direction again.
Right.
So
right.
This may help. With all these, you're going to want to experiment and try and see what works.
Mm-hmm.
It may work for you. I mean, we're always surprised at what works for patients and doesn't work for them. It's, you know, it's not cookie cutter.
Right.
Yeah.
But just keep with it. Do some of these options, and you're going to find the recipe that's going to work for you. Sideline, Bob.
This is one where this mattress works really nice,
I know.
Brad.
I was working with this the other day, and I was like, I don't even know if you need any of these things.
No, if you're using this mattress, you wouldn't need to do the next two things. But again, we're going to give you a list of expensive options.
Sure. With the exception of, you know, if you're going to put a pillow between your knees, that would be the only thing.
Yeah.
But we do want to, oftentimes there's this gap in here. If you've got a mattress, particularly an old mattress that is kind of wore out and has a hole in there, so to speak.
But this mattress, again, look how well it fills in that gap.
Right.
Because if you don't have the gap there, your back can actually round out a little bit like this.
As a matter of fact, we can
Yeah,
show it
if
very
you show it on,
clearly.
yeah, there you go.
Can you hold that pelvis right here, Bob?
Yeah.
There you go. So what happens, the spine we want neutral, but it sags down, and then you get this curve in there, which is okay for a little bit, but after a while,
It'll start bothering the facets on the top.
Exactly.
And the nerves on the top.
I have this exact situation with the bed I got right now. Okay, now, let's see. Here we go.
All right.
You can just take a simple towel roll, put it through there.
And you can actually even pin it or tape it or something.
Right.
Just don't have a pin sticking you in the middle of the night. And that can actually fill in that gap too.
Right. And the towel roll, you can roll it thicker or thinner depending on your body shape, how your mattress is. They do make sleep rolls, they call it, by McKenzie. We really, McKenzie makes some excellent products, and you can use this, and we won't put it on Bob, but you can see it wraps right around, and it does the same thing as that.
The other thing is if you're sleeping on your side, it does a lot of times to help kind of bring your knees up a little bit.
Sure.
And sleep in that fetal position.
Right.
Because it opens up the back, and you know, the problem is now if you have a herniated disc, you don't want to do any of these things.
Sure.
This may make a herniated disc or sciatica actually worse.
The flex position.
The flex position,
Sure.
right. So, and even, I don't know if it'd make this, I don't know that this would make it worse.
I think it depends on the severity of the herniation. You know, that can vary whether you use the leg sleep wedge or not.
Again, this is going to tend to be for people who have spinal stenosis, arthritis, spondylolisthesis,
Anterior
degenerative
pelvic
disc,
tilt.
yeah, and so these are the things that where it's
Yeah,
gonna
they
help.
all fit together in the same category. So,
All right.
well, Bob, I think once again we've solved another problem that we can fix with the body, except
Yeah, we can fix about anything except a broken heart.
There you go.
And we're working on it though. We'll eventually get to it.
say no more, Bob.
All right, I won't.